Hello, my name is Doneen Day. I am the coding educator for most of surgery, and today I will be speaking to you about the global surgical package. The global surgical package includes all necessary services normally furnished by a surgeon before, during, and after a procedure. Payment for the surgical procedure includes the preoperative, intraoperative, and postoperative services. Physicians in the same group with the same specialty will bill and be paid as though they were a single physician. There are three classifications to the postoperative period. There's a 0-day postoperative period, a 10-day postoperative period, and a 90-day postoperative period. I'll start with the 0-day postoperative period, which includes endoscopies and some minor procedures. No preoperative period for the 0-day postoperative period, no postoperative period, and the visit on the day of the procedure is generally not payable as a separate visit. For the 10-day postoperative period, that includes other minor procedures, there is no postoperative period. Again, the visit on the day of the procedure is generally not payable as a separate service. Total global period is 11 days. You count the day of the surgery and 10 days following the day of the surgery. The 90-day postoperative period includes your major procedures. There's a 1-day preoperative period that is included. The day of surgery, the day of the procedure is generally not payable as a separate service. The total global period is 92 days. You count 1 day before the day of surgery, and the 90 days immediately following the day of surgery. What services are included in the global surgical package? Preoperative visits after the decision is made to operate. For major procedures, this includes preoperative visits the day before the day of surgery. For minor procedures, this includes preoperative visits the day of surgery. Intraoperative services that are normally a usual and necessary part of a surgical procedure. These are all things included. Also is additional medical or surgical services required of the surgeon during the postoperative period of the surgery because of complications which do not require an additional trip to the operating room. Also included are follow-up visits during the postoperative period of the surgery that are related to the recovery from the surgery. Post-surgical pain management by the surgeon, supplies, miscellaneous services. All of these things are included in the global surgery payment. Dressing changes, local incision care, removal of operative pack, removal of cutaneous sutures and staples, lines, wires, tubes, drains, casts, and splints. Also included is the insertion, irrigation, and removal of urinary catheters, routine peripheral intravenous lines, nasogastric and rectal tubes, changes and removal of tracheostomy tubes. These are all included in the global surgery payment. What services are not included in the global surgery payment? Services of the other physicians related to the surgery, except where the surgeon and the other physician agree on the transfer of care. This agreement may be in the form of a letter or an annotation in the discharge summary, hospital record, or ASC record. Visits unrelated to the diagnosis for which the surgical procedure is performed, unless the visit occur due to complications of the surgery. Treatment for the underlying condition or an added course of treatment which is not part of the normal recovery from surgery. Also not included is the diagnostic tests and procedures, including diagnostic radiology procedures. Also, clearly distinct surgical procedures that occur during the postoperative period, which are not reoperations or treatment for complications. A new postoperative period begins with the subsequent procedure, including staged procedures. Treatment for the postoperative period complications requiring a return trip to the operating room. So if the patient has to go back to the operating room for a complication of the surgery, That is payable separately. That's not included in the global surgery payment. If a less extensive procedure fails and a more extensive procedure is required, the second procedure is payable separately. Immunosuppressant therapy for organ transplants and critical care services are not part of the global surgery payment. The E&M visits can also be billed during that time. Modifiers. Modifier 54 is for surgical care only. Modifier 55 is for post-operative management only. We have renowned physicians here, surgeons, and sometimes we have patients that come from all over the Southeast. So they may come to Emory Healthcare for their surgical care, but then return to their city for their post-operative management. So that's a lot of times where we would use those modifiers. Modifier 57 is the decision for surgery on an E&M service the day before the major surgery or the day of a major surgery that result in the initial decision to perform a surgery are not included in the global surgical package. So with a 90-day global period, the day before is included in the post-operative payment. But if you see the patient and you decide to do surgery that day or the next day, you can bill that E&M visit. Modifier 25 is a significant, separately identifiable E&M service by the same physician on the same day of the procedure. Indicate the patient's condition required a significant, separately identifiable E&M service beyond the usual preoperative or postoperative care associated with the procedure or service. Modifier 25 is one that the OIG looks at highly. Modifier 79 is for unrelated procedures or service by the same physician during a postoperative period. A new postoperative period begins when the unrelated procedure is billed. Modifier 24 is for unrelated E&M service by the same physician during a postoperative period. Modifier 78 is for unplanned return to the operating room or procedure room by the same physician following the initial procedure for a related procedure during the post-operative period. And going back to modifier 24, the unrelated E&M service by the same physician during a post-operative period, we have multiple specialties across one specialty sometime. I should say subspecialties. So it's reasonable that an E&M service could be unrelated to the service that was provided by another group in that specialty. Modifier 58 is staged or related procedure or service by the same physician during the postoperative period. This is planned postoperatively or at the time of the original procedure, more extensive than the original procedure, for therapy following a diagnostic surgical procedure. This was a presentation on the global surgical package. I hope this helped.